And back now, Sunday House Call. Do you suffer from chronic pain? We know researchers are offering hope to millions of people who do after they say they've discovered a so-called off switch to a gene that they say is responsible for the condition. So, Dr. Siegel, first of all, what is chronic pain? I mean, you have it all the time. Can you get rid of it?
There's 100 million sufferers of chronic pain in the United States. It's a system that's supposed to help us, Eric, going awry. Because pain is supposed to warn us about something, danger. Disease is coming. When you get an illness, you feel pain from it. It's a body's warning system. Yeah. If you banged against a wall, it hurts you because you don't want to keep banging against the wall. Body's warning system. But when you can't shut it off, it's chronic pain. And 100 million pain sufferers leads to addictions, to medications, opiates, narcotics. That is an enormous problem in the United States. So the idea that we could come up with a novel approach to this is terrific. But I'll answer your next question before you ask it. This is not ready for prime time. We're not going into the doctor's office with this yet. What they did was they found a group of people who genetically didn't have any pain. 1 in a million people didn't have any pain. And this is sometimes the way they get to a cure. They say, why didn't they have any pain? They found out that they had a variant to a specific gene. And when they had that variant, their nerves in their body didn't make any pain receptors, so they didn't feel pain. Well, we don't want that either.
Yeah.
But by figuring out this gene, if we figure out drugs to block this gene, we'll have a whole new group of medications we can use instead of these terrible opiates.
But if you have chronic pain, it seems to me that something's wrong. And that wouldn't that be the basis of trying to address that?
I think this study has a long way to go before it shows up on clinical trials, but your point is well taken. As the American elder population is getting bigger and older, we're going to be dealing with this chronic pain at every level, whether it's arthritis, spine problems. We're sitting behind the computers, we're using our iPads more, and we're not moving as a nation like the way we used to, and that's why you have all the obesity. By the way, obesity alone can cause all of the pain that we have in our back because of that weight.
Great point. Great point.
Yes, we can do a lot of these studies, and I think this is a step forward, but they're finding a gene that may or may not pan out. But pain, as Marc mentioned, is important because if you sit on a warm area, that's your defense mechanism that says, get up because you're going to have a first-degree burn. When you hit your hand somewhere, that's your defense. So I think that while there are a lot of these spinal treatments and epidurals and all this physical therapy, I'm sorry to say that going back to alternative route, using capsaicin, which is a derivative of the chili pepper, is one way to go. It inhibits substance P.
Where do you get
capsaicin? It's all out there. You can buy them. Adding turmeric to your food, which is a lot of anti-inflammatory, that can help. Ginger, which is one of our favorite in this program. All of these alternative things that we can use for such a thing is a first therapy before you go to your Vicodin and, again, another addictive medications. So I would go with this route before anything else.
And to add to that, there's this new medication on the market over the last few years that I love, which is Voltaren gel, where you can literally rub it into the area.
I have some of that.
That's great stuff for certain things that we couldn't reach before. I want to underline one more point here, why we're even talking about this. Get this. Chronic pain, 100 million Americans. Diabetes, which we love to talk about on this show, 25 million Americans. Heart disease, 16 million Americans. This is 4 times as many sufferers. And granted, David's earlier point is great, which is they're related. You have diabetes, you end up being obese, you end up with back pain. Everything we do in medicine ties together.
But let me just say,
pain is a huge problem.
Yes, I agree with you, but I don't want to undermine the importance of blood pressure and diabetes because that kills. Chronic pain, you don't die from it, you may suffer from that. But also, it's a good time to say...
So what's your point about that?
My point is that besides weight loss, besides a lot of things that we're talking about here, stick to yoga, stick to meditations, acupuncture sometimes, and as a surgeon to push this alternative treatment.
Oh, yeah, acupuncture. They talk about that a lot.
That's a great
Again, but the problem with acupuncture is that everybody's opening up a shop. They claim they know what they're doing, and they don't. You have to look for an experienced person who's really well trained and knows the nerve endings and be able to put the right pressure at the right time.
And also, one more to add to him, this is physical therapy. Because if you have back pain, orthopedic injuries, before you go rushing to the pain meds, which then you become addicted to, get into some physical therapy programs. Those can work really, really well. And weight loss, especially for back.
See the orthopedic surgeons or go to physical therapy?
Or a neurophysiologist.
What about massages? Because I mean, in most cities now they have all of these massage places, deep tissue massages. Does that help? Or
I love that. I love that, Arthel. But
no, I'm being serious. But you have to be careful though, because some people,
his earlier point, you got to be careful that the person is qualified, and then don't go rushing to someone who does that without an expert like we talked about clearing you first and making sure there isn't some serious underlying problem. Understand what you're dealing with before you go rushing to solution.
You know where I was going with that was, first of all, what is that cream you said?
Voltaren gel.
I was using it because I had like some sort of, this muscle was just like really chronically hurting me, but it's okay now. Just to clarify, because like, well, why is she using that? Because
no, nobody's going to judge the lady.
It's an anti-inflammatory. You know, it's like the Advil or the Aleve that you take, but it's something you can rub.
I mean, that can be an issue if you take too much of that. I mean, it's easy to pop those.
Yeah, Advil.
Too, yeah. Or any of those.
Huge problem.
I know they're telling us to tease, but can I just ask this one question? What I'm saying here is that we're in New York, we do acupuncture, we do yoga. What about people in middle America? What should they do?
Swimming. Everybody can swim because these are, non-weight-bearing exercises.
Or elliptical or bike.
Exactly. And you do those exercises. You can basically take a rope and start your exercise before. The idea is don't start taking Vicodin and Percocets and those kind of things.
They're called low-impact exercise. Low-impact exercise like swimming, David's point, elliptical, bike.
And he wants me to go to Chinatown for a massage, and I refuse. So next topic.
I have vetted the place. He will like it.
All right.